This is part 2 of chronic viral hepatitis, prepared by Dr. Sameh Ghaly, Professor of Internal Medicine, Head of Hepatology and Gastroenterology Department. We are going to discuss chronic hepatitis virus hepatitis. Well, this chronic hepatitis due to hepatitis C virus is common after acute infection, where patients present with elevated SGPT in about 60% of patients, with anti-HCV antibody positive, hepatitis C virus RNA is also positive. The natural course of hepatitis V virus infection starts with the acute infection, then 15% to 45% of the patients the infection gets resolved, while the rest 55 to 85% complete to become chronic HCV patients. In 75 to 95% the condition is stable, while in 5 to 25% liver cirrhosis occurs. In 96 to 98% per year they remain stable, while in 2 to 4% per year become decompensated or develop HCC. Well, hepatitis C virus causes the following. It causes acute and chronic hepatitis. It may cause liver failure and cirrhosis, hepatocellular carcinoma, esophageal and gastric varices. There are also extra-hepatic complications of hepatitis C virus infection, as cryoglobulinemia, Sjogren's syndrome, a low platelet count, Lichen planus, which is a skin disease condition, Porphyria, Cutanea, Tarda, insulin resistance, even diabetes mellitus, and diabetic nephropathy. This is a picture showing a case of Porphyria, Cutanea, Tarda. This is a picture showing Lichen planus. What about the laboratory features of chronic hepatitis C virus? We find elevated ALT and AST. They do not correlate to the severity of liver damage, while elevated bilirubin level and alkaline phosphatase. Neutropenia and lymphopenia are followed by relative lymphocytosis. Impaired synthetic function of the liver is manifested by prolonged PT and decreased serum albumin. There are virological tests for HCV. As we said, anti-hepatitis C virus antibody, which takes 6 weeks to 12 months to develop. ELISA is the test for HCV antibody. False negative cases occur in immune-compromised patients with HIV and renal failure, while false positive results occur in autoimmune hepatitis. Hepatitis C virus RNA detection can be made by qualitative and quantitative PCR. This is used to confirm viremia and to assess response to treatment. Viral genotyping is useful in choosing therapy. How do we treat chronic hepatitis C virus? Well, interferon was one of the modalities. Now it is obsolete. Ribavirin with unknown mechanism of action, while the DDAs or direct-acting antiviral drugs having the upper hand nowadays. What are the direct-acting antiviral drugs? As we know, hepatitis C virus genome structure includes the core, C, the envelope, E, and the non-structural protein, NS. Well, NS3, 4A inhibitors, they are inhibitors of the non-structural protein part as Cimeprevir, while the non-structural 5A inhibitors as Edipasvir and Daclatasvir, while non-structural 5B inhibitors as Sofosbuvir. Please be ready with your questions in the next face-to-face session. Thank you.